Hey y'all, welcome back to my channel The Document. My name is Dominique if this is your first time here, and welcome back to another freaking video. As you can tell by the title of this video, today we're talking about gestational diabetes. 9 times out of 10 you clicked on this video because you want to know a little bit more about gestational diabetes. You may be a little bit confused about what it is, how it's diagnosed. So we're going to discuss that topic. So if this sounds like something that you all are interested in, just keep on watching. So I decided to talk about gestational diabetes here on my YouTube channel. As you all know, I am a registered nurse and I'm currently pregnant. I am going on 36 weeks in a couple days, and I feel like why not talk about this topic, being that it is pretty common in pregnant women, and this is what I've currently been going throughout my pregnancy. So let's jump right into it. What is gestational diabetes? Gestational diabetes is a type of diabetes that is caused by high blood sugar levels during pregnancy. The actual cause of gestational diabetes is unknown, but it is thought that a woman's placenta hormone is actually how the body affects how cells absorb blood glucose levels. So your placenta is actually an organ that delivers blood and nutrients to your baby. So what are the risk factors? Some risk factors include having an immediate family with diabetes, being overweight or obese, being pre-diabetic, being over the age of 25, having gestational diabetes with a previous pregnancy, and not being physically active. So in other words, if you have a placenta, you are at risk for developing gestational diabetes. When I first became aware that I was pregnant, I went to my OBGYN. They made me fill out my health history, and on that health history form it asks you to list certain things that people in your family are diagnosed with. I know that diabetes is pretty prominent in my family, so this allowed my doctors to treat me earlier than the average person. So I actually was diagnosed with gestational diabetes only at 14 weeks pregnant. And you get tested for gestational diabetes between 24 and 28 weeks during your pregnancy, or sometimes a little bit later. So being that I knew my family health history, my providers decided to take my glucola test a little bit earlier than the average pregnant person. So it's important to know your family's health history so that way you know what to look out for when you're going to see your primary care provider. So how is gestational diabetes diagnosed? So like I said before, typically you take a glucose tolerance test, and you take this test around 24 to 28 weeks of pregnancy. In my case, I did it early, but your doctor will have you come in and you will drink a glucose solution. This glucose solution comes in different flavors, and they give you 50 grams of glucose on your first test. So the first test you take is a 1-hour test, and you drink the glucose drink, and within 1 hour they draw your blood to see what your glucose levels are. Depending on where you live and what providers you go to, they'll tell you what range is normal, but normally a normal blood glucose level is between 70 and 120. If your blood sugar level is a little bit higher than 120, they're likely gonna say, hey, this is too high within an hour of drinking your blood glucose drink, so you're likely predisposed to gestational diabetes. So you would go in for a follow-up test, which is a 3-hour test then, and you would drink that same glucose drink, but this time they will give you a glucose drink that is higher in glucose. So the second time I went in to take the blood glucose test, which is a 3-hour test, they gave me 100 grams. They doubled the amount of sugar that was in the first drink. They test you every hour on the hour for 3 hours. So you basically have to sit at your OBGYN for this test for 3 hours. They will stick you before to get a fasting blood glucose level, and then every hour after to make sure that your blood sugar level is staying the same, or if to see if it's rising and falling. So this is how they kind of diagnose whether you have gestational diabetes or not. So if you fail the 1-hour test, you have to go in for the 3-hour test, and if you fail the 3-hour test, then that is how they diagnose you with gestational diabetes. In my case, I failed both. So they diagnosed me with gestational diabetes. When I got diagnosed with gestational diabetes, I was devastated because I was thinking to myself, like, how could I let this happen? It's all my fault. I'm eating poorly. I'm overweight. Like, it was just me blaming myself. But I want anyone that's on the other end of this screen to know that it's not your fault. Everybody that has a placenta can get gestational diabetes. It is mainly caused by your placenta hormone. I just want to emphasize that it's not your fault, number one, because somebody can eat the cleanest and the healthiest and still be underweight prior to pregnancy and still be diagnosed with gestational diabetes. Somebody can be overweight and still be diagnosed with gestational diabetes. It all depends on your placenta. So I just want anyone on the other end of this screen to know that it's not your fault. But it can be managed. So how can it be managed? You can manage your gestational diabetes by maintaining a healthy diet during your pregnancy, exercising, and monitoring your blood glucose levels. So likely when you're diagnosed with gestational diabetes, your doctor will send you for a nutrition consult. And at this nutrition consult, you will talk with a nutritionist or dietitian, and they will tell you how to properly eat during your pregnancy. No, it's not ideal. Yes, we have pregnancy cravings. Yes, we want to eat what we want to eat. During pregnancy, I've learned that there is a lot of sacrifice. There is a lot that we're giving up to bring babies into this world. And this so happens to be one of those things. If you decide, hey, I don't care about my blood glucose levels being super high, I'm not gonna check my blood sugars every day, then you're likely putting your baby at risk. Why? Because once baby is born, when they're in womb, they eat what you eat, they drink what you drink, and when they are exposed to high blood sugar levels and baby is born and they're taken out of that environment, likely their blood sugar is going to drop. Not only does having high blood sugar levels during pregnancy put your baby at risk, but it also puts them at risk for being large, growing super fast in the womb. So when you have a large baby, likely they cannot pass through the birth canal, and it's either you'll have to have an emergency C-section or you're putting your baby at risk for shoulder dystocia. Shoulder dystocia or macrosomia. So macrosomia means a large baby, and shoulder dystocia pretty much means that your baby's shoulder gets stuck in the birth canal when they're passing through, and it puts them at risk because they get stuck, and then it's likely a medical emergency. So those are two things that you don't want to happen during your delivery. So it's just best to maintain your diet throughout the pregnancy overall. So what are some possible indicators that you may have gestational diabetes prior to being tested for your blood glucose level? So some people may have extreme tiredness after completing a meal, or just craving a lot of sweet savory things, such as things that you didn't crave prior to being pregnant, like chocolate cake. For me, it was Dr. Pepper. I have not been a soda girl for a long time, but since becoming pregnant, it's like I always needed a soda with a meal. So just pay attention to the cravings that you're having and try not to acknowledge the cravings every single time you have them, or opt for a more healthier alternative, such as like a diet Dr. Pepper or a Poppy or a Olipop or something like that. Instead of getting fries, try to get a kale salad or a broccoli or a side of fruit. So yeah, as far as managing your diabetes at home, your doctor is going to also set you up with they will likely set you up with a diabetes counselor, or they'll order a glucose machine from your local pharmacy. So this will include like a glucose machine, test strips, and lancets. So they are also going to require you to check your blood sugars at home. So you must check your blood sugar 4 times a day. 1 including fasting, the other 3 including after each meal. So you usually check your blood sugar between 1 and 2 hours after a meal, and your fasting blood sugar should be a little less than 95, and your after meal blood sugar should be less than 120 to 140. If those numbers are a little bit higher, they will likely either decide to put you on insulin, or you can try to tweak your meals a little bit because everybody's body is different. If I was to have 1/3 cup of rice with my meal and my blood sugar was fine after I ate, then that means I can tolerate that amount of rice. But if my blood sugar spiked after having that 1/3 of rice, then that's probably likely something I should not be eating during my pregnancy. So it kind of all depends. That's why it's best to keep a food diary, so that way you know what is spiking your blood sugar and what isn't, and keep a blood sugar log, so that way when you go to your OBGYN, they can tell you whether your levels at home are too high, and they'll decide managing your diet at home is not working, and they will have to put you on some form of insulin to control your blood sugar so it's not being transferred over to your baby. I'm going on 36 weeks in a couple of days. I've been managing my blood sugar levels at home with diet since 14 weeks, which I'm super proud of. So I just decided to come on here and talk about this topic because I know that it can be a little bit hectic. If you are someone that is suffering from gestational diabetes, just know that there is light at the end of the tunnel, and this can kind of be a motivator to clean up your diet during your pregnancy, so that way once baby is born, you can keep these healthy habits going and overall prevent type 2 diabetes. Because studies have shown that moms who have gestational diabetes are more likely to develop type 2 diabetes in the future. So just think of it more so in a positive light, and when baby's born, try your best not to go back to your old habits to prevent type 2 diabetes, because you have to choose your heart in these types of situations. Checking your blood sugar 4 times a day for 9 to 10 months, or checking your blood sugar for the remainder of your life. You have to choose your heart. So keep a positive mindset. Just know that it's not your fault, and know that this is also helping you to have a healthier future for you and your baby. Okay, so I just wanted to show y'all how I check my blood sugar at home. So my doctor ordered this blood glucose machine, which is the Accu Chek Guide Me, and it comes with a glucometer, a glucose pen, lancets, and test strips. And then I make sure I change my needle with each puncture, and I go ahead and load my needle into my pen and put the cap back on. This pen has different settings of how strong you want the pen to puncture your finger. So it's labeled 1 through 5, and 5 being the strongest of the puncture. If you have really tough skin, you may use a 5, but if you have really thin skin, you may use a 1 or a 2. Then I take my test strips, and in blue you can see that there's an expiration date on there, and I load that into my glucose machine, and it will give me an indicator that the machine is ready for me to insert the test strip. And then once it gives me this indicator of the drop of blood, it's okay for me to place blood on the test strip. So all I do is pick a finger and I clean it off with the alcohol swab, and then I go ahead and puncture the site. Here you see me checking my blood glucose in the morning, which is my fasting blood glucose. This is the result, which is within normal limit for me. So that is how I check my blood sugar at home. I stick myself 4 times a day, and I do this after each meal. So yeah, this water bottle here is almost full, as y'all can see. I want to say it's about over 200 needles in this water bottle. I've had to stick myself every day for 4 times a day for a majority of my pregnancy. And you want to use a water bottle or a plastic soda bottle or a bleach bottle, just some type of container to contain your sharps, so you're not contaminating anyone else, or no one else is getting stuck with needles that you've previously used. And this is considered like safe needle disposure. I also wanted to give y'all a couple meal ideas. 9 times out of 10, I'm likely eating scrambled eggs and chicken maple sausage, but I will change out my carbs. So I would do like a protein waffle or a protein pancake, or cheese grit, a biscuit, a hash brown. Yes, that is mainly what I would do for breakfast. I also may opt for like boiled eggs or oatmeal for breakfast time. I'm not a big snacker, but when I do snack, I tend to grab something fairly quick, like a Fairlife protein shake. I get these from Sam's Club. And protein is really good to help you stay full a little bit longer. Or I'll do yogurt with granola, some mixed nuts maybe, even some fruit sometimes, but I try not to go overboard with the fruit just because they're high in sugar. As far as like lunch or dinner, I'm always either throwing a salad into play. So I love the Caesar salad kits. So here you see me have some Alfredo pasta with shrimp and broccoli and garlic bread. So I make sure that I'm not consuming too many carbs. I do weigh my carbs on a food scale or use the recommended amount, 100 or 120 grams of pasta. So that way I'm controlling how much carbs that I'm eating per meal. So like here you see I have ground turkey, rice, and a veggie. So I try to keep it very simple with my meals, protein, a carb, and a veggies. Per my dietitian, it's not super strict for me to eliminate carbs that I love like pasta, rice, or bread. It's just I have to control how much carbs I'm eating in one sitting. So the name of the game is to follow a carb control diet. So that concludes this video. As always, thanks so much for watching. Please don't forget to like, comment, and subscribe. Don't forget to turn on your bell post notifications so that way you are notified whenever I upload another video. And I will see you all in my next freaking upload.
My ain't just changed. It just was the wrong day. Thank God you came. How many more days?